So this set of PowerPoint notes is posted as blank slides, so you can record them, or you can look at them and take notes while I write on them. Okay, so it's important to realize that the circulatory system is the heart, blood vessels, which I'm going to abbreviate BV, okay, and blood. So it's all three things, whereas the cardiovascular system, so if you think cardio is heart, okay, and then vascular would be the blood vessels. So cardiovascular does not include the blood. Okay, now there are two big subdivisions of the cardiovascular system. So one is the pulmonary circuit. So if you think about pulmonary is going to go to the lungs. And then systemic is going to go to the whole body. So the flow of the blood, so this is going to go to the whole body. The flow of blood, I always tell students to remember right, then we go to the lungs, where it's going to get oxygenated, and then the blood is going to go to the left side of the heart. So we go from the right side of the heart to the lungs, and then goes to the left, and then from the left it'll go to the rest of the body. So that's the flow, and we'll go over that a couple times through here. Okay, now, three main types of vessels. So the best way to define these are artery. Arteries always carry blood away from the heart. Veins carry blood towards the heart. Typically, we look at arteries as red and veins as blue, but that is not always true. Okay, so there are some exceptions to that rule. So it's better to know that arteries are blood vessels that take blood away from the heart, and veins are vessels that take blood towards the heart. Capillaries are the microscopic vessels where gas exchange, nutrient exchange takes place. So this is what's going to feed the tissue. So capillaries are small, so exchange is the important part of that. Okay, now, whoops, wait a minute. We move here. Okay, so here's a picture that's showing all of the circuits. Okay, so it's going to show the two circuits. So this is the pulmonary circuit at the top, and then this is the systemic circuit. So basically what's going to happen is the pulmonary circuit's going to take the right side of the heart. It's going to take blood to the lungs, okay, where it's going to pick up oxygen. Okay, and then the left side of the heart, the blood is going to return the oxygen-rich blood, which is represented as red here, is going to take the blood back to the heart on the left side. Okay, so right, lungs, okay, where we're going to pick up oxygen, and then left is how it'll return. Okay, this is the pulmonary circuit, right? Pulmonary makes sense. We're going to the lungs. Okay, systemic circuit, the left side of the heart is going to pump oxygen-rich blood. So oxygen-rich blood will be going to the body, okay, where we're going to drop off the oxygen, okay, and pick up carbon dioxide and the waste, and then that's going to go back to the heart. So the arrows are labeled here, but this is the kind of the way it goes. So right, then lungs, left, and body. And this will make sense when you start to learn about congestive heart failure and how fluid can accumulate in the lungs, or how fluid can accumulate in the extremities. Okay, but we just want to get started with this. Okay, so if we're taking blood away from the heart, these are arteries. So the pulmonary arteries are going to be blue, okay, and the pulmonary veins will be red because they're taking blood towards the heart. So that's one difference that I think you saw in lab. Okay, now the size and the shape and the position of the heart. Okay, so we say that the heart is located in the mediastinum. So the mediastinum is everything in the thoracic cavity except for the lungs. Okay, so I need a better stylus, but this is what we have for right now. So everything in thorax, okay, but the lungs. Let's see. The heart is posterior to the sternum, okay, so it's usually between ribs 2 and 6 is where we're shooting for. It's about the size of a fist, so you could take your fist and pretend like you're saying the Pledge to the Allegiance. Okay, so it's off center, so it's more to the left side of the body than to the right. So if you take your right hand and make a fist and put it over your heart, right, it's going to be more to the left side of your body. The apex of the heart is here. Okay, so that is the point. Okay, and this is considered the base up here. Okay, so up here, if we can make, oops, that's lovely. Okay, so up here, this is the base of the heart. And we say, they say it's about 300 grams, or about the size of your fist. Okay, so here's the diaphragm. Okay, so diaphragm is there. Apex, here is the, let me find a pointer. Where's the pointers? I think this is a pointer. Nope, that's not a pointer. Do you guys see that? There's the text. Here's the pointer. Here's the pointer. So let me see if I can point. Well, that's kind of laggy. Okay, so here's the base. Okay, there's the apex. There's the diaphragm. These are the lungs. Okay. We'll go over the parts. We'll do a fast review of those. Okay, so let me move the page. Okay, so I'm pretty sure that Mrs. Josick went over this in lecture, so I'm just going to use the pointer to highlight this. I know she had this picture drawn on the board. So it's important to realize that the heart is in a sac, and the sac is called the pericardium. Okay, so the pericardium is divided into several layers. So it has, we have, let's see, I'll make it, it's divided into several layers. So we have the parietal pericardium and the visceral pericardium. Okay, the visceral pericardium is going to lay right on top of the heart. So it's right on top. It touches it. So it's visceral. It's deep. The parietal pericardium is on the outermost layer. Okay, so the pericardial cavity is the space that the heart is in. In order to do heart surgery, you would have to cut through the pericardial sac, okay, or the parietal pericardium in order to get to the heart itself. Okay, the parietal pericardium has 2 layers. It's got a fibrous layer, which is really tough, and then the serous layer. Okay, so the serous layer, if you guys remember, you think about serous fluids when you learned about tissues. Okay, so it's made of epithelium, and it's going to secrete serous fluid so that you don't feel your heart beating in your chest. So it's going to reduce friction. Okay, so there's serous fluid in there to reduce friction. So that should be familiar. Okay, now, so if we go through the layers, so let me just grab a pointer here and show you. If we go through the layers, and I'll get an arrow, and I think I can erase. Let me try to remember how to erase. Erase the text that's on here. Nope, that didn't work, did it? X. Nope, that's not going to do it. X. Undo. Well, that's not good. All right, well, let me draw it. I'll draw it. Okay, so if we look at the layers of the heart, okay, so here, so let's say this is the heart, okay, and you look at it. The really thick muscle layer, that's the myocardium. Okay, so that's the thickest layer. That's the muscle. Okay, the next layer, as you're working your way out, that's going to be the visceral pericardium. So that's the visceral pericardium. Okay, and then as you continue out, okay, there's going to be the parietal pericardium. Okay, so this is the muscle. This is the muscle. Okay, and when you do the dissection, you're really going to see that. So that's the muscle. Okay, then there's going to be a membrane laying on top of it. Then there's a little bit of space where the serous membrane will be. Okay, and then there's the parietal layer. Okay, the endocardium is inside. Okay, now I think what I'm going to do here is I'm going to stop and save this and upload it so that it's not a huge, long, huge file.